To help parents cope with rising healthcare costs, Health Minister Gan Kim Yong announced a new $10 million scheme called Medifund Junior.
Today I'm pleased to announce that the Ministry of Health will be introducing Medifund Junior. This Medifund Junior will provide targeted help to children up to the age of 18, so that they, especially with the larger bills, especially for the lower income up to middle income families.
Previously, the Ministry of Health spent an average of $6 million per year to help cover medical bills of children from needy families. With the additional $2 million each year, or $10 million over 5 years, public hospitals have the discretion to help some middle-income families with funding too.
Medifund generally is overall targeted at the low income, but for Medifund Junior, there's flexibility for them to also cover up to a middle income, especially for bills that are larger. So the hospital will then make the necessary assessment, taking into account various factors in deciding whether to provide this assistance and to what extent the assistance will be given.
The money allocated to Medifund Junior will not affect current recipients of the main Medifund.
This fund will be made available through the injection of $600 million into the Medifund capital that was announced during Budget 2012. This $600 million will generate income, and the income is used for Medifund on an annual basis, and the $10 million will come from the income that's generated from the $600 million injection into the Medifund capital.
Mr. Gan was speaking to reporters after a tour of KK Hospital, where a new neonatal intensive care unit for newborns is being built. Currently, the 24-bed facility is running near full capacity, but in 5 years' time, it will have 40 beds. Despite falling birth rates in Singapore, demand for neonatal care and services has been rising between 5 and 10% every year.
One of the main reasons is that some of them are getting married at an older age, and they're giving birth at an older age, and some of these trends may give rise to more premature babies being born. And of course, with the advance in technology, medical technology, more of the premature babies are now being able to be saved, and therefore they are born well, and therefore we need to look after them better.
Assisted reproductive technology and in vitro fertilization is another reason for the growing demand in neonatal care. Parents can pay up to $1,000 a day for neonatal care in KKH. The announcement of Medifund Junior comes a day after a new Medisave cash grant of $3,000 for newborns was announced as part of the Enhanced Marriage and Parenthood Package.